the Supreme Court's decision on the OSHA mandate essentially means that in this pandemic, it is up to individual employers to determine whether their workplaces will be safe for employees.
The Supreme Court on Thursday blocked the Biden administration's vaccine requirement for large businesses, but it will allow the administration to enforce a mandate for most healthcare workers. President Biden said he was disappointed that the business mandate was knocked down, but said the health worker requirement would save lives. Let's bring in Dr. Craig Spencer, ER doctor and director of global health and emergency medicine at Columbia University, and Dr. Uché Blackstock, ER doctor and MSNBC medical contributor. Thank you both for joining me. Dr. Blackstock, your reaction to this decision from the Supreme Court?
Thank you so much for having me, Mehdi. Well, I am profoundly disappointed. This is a major blow to any potential progress in the pandemic. It's going to prolong the pandemic, and it'll cost lives. I do think the Biden administration still has much to do. I think they can try to push the vaccine mandate through again without having a size exemption, so they could try that. But I think also this is an opportunity for them to help provide federal guidance on how we can make workplaces safe around masking, around testing, and capacity restrictions. I also think that this puts pressure on the states and localities to enforce their own vaccine mandates, as we've seen states already do, and in cities like New York City, my own city. But I think this isn't a time to recoil. This is the time for us to really push harder to get vaccines mandated. We can even try for an air travel vaccine mandate. But this is an issue of how do we get more people vaccinated, and also how do we make workplaces safe?
Dr. Spencer, in a New York Times op-ed this week, you say that while your patients are facing milder cases than in March 2020, they're still taking up hospital beds and resources. It's still dangerous. You say we should not be lulled into complacency because this variant seems milder. But listen to what Dr. Fauci said this week.
Omicron, with its extraordinary, unprecedented degree of efficiency of transmissibility, will ultimately find just about everybody.
Do you agree with Dr. Fauci? I mean, I don't hear public health experts in other countries saying, you're all going to get it. It's a bit defeatist and dangerous, is it not?
Absolutely. Look, I've been working in the emergency room with this virus for nearly 2 years, and I've been exposed to it all the time, sometime with every patient I'm taking care of every day, and I haven't yet, quote, gotten it. Look, we have vaccines that do protect us, that keep us safe, that keep my family safe. And that's why, like my colleague, Dr. Blackstock, I'm disappointed with the decision today at the Supreme Court, because what we know that after we've had these vaccines for a year, there's just a subset of people that are not going to get it unless they're mandated to get it. We know that mandates work. And more importantly, we know that vaccines work. Even if they don't prevent transmission spread as much as we hoped, I am seeing right now that the overwhelming proportion of people who are coming to my hospital, needing hospitalization, needing oxygen, who are really sick, are the unvaccinated. So we need to do everything we can, whether by mandate or any other means, to make sure we increase the proportion of people that are vaccinated so that we don't have an overwhelmed healthcare system, that we have a functioning 911 system, that we have clinics and hospitals that people are able to go to where we have staff and the beds to treat them.
And Dr. Blackstock, you mentioned a moment ago that it is maybe up to the states now. Of course, a lot of those states are red states run by Republican governors. Florida, for example, where Ron DeSantis has been basically COVID's #1 ally. I want you to take a listen to your former medical school classmate, Joseph Ladapo, who somehow ended up as Surgeon General of Florida.
We're going to be working to unwind the sort of testing psychology that our federal leadership has managed to, unfortunately, get most of the country in over the last 2 years.
No need for testing, he says, standing at a podium that says early treatment saves lives. You tweeted that you were speechless when you learned of Dr. Ladapo's weird anti-science stances on masks and testing. I've got to ask, how did he complete medical school? Was he there in class with you? Was he asleep all those years?
Well, I'm still speechless. My mind is blown every time I hear him speak. He's actually very smart, but I think he has political ambitions and motivations. And so unfortunately, that is part of it. But as we know, testing is such a key pillar in containing this virus. It helps us identify who's infected and who needs to be quarantined. And so what he basically is saying is everything that is, against science, against any evidence that we actually have And I think that his rhetoric, unfortunately, is going to influence policy in Florida and, again, cost lives of many Floridians in the process.
Yeah, and Dr. Spencer, I feel like some of us are stuck between some weird positions. You have the Dr. Ladapos of this world who are saying nonsense. And then you have the Dr. Fauci's and Dr. Walensky of the CDC's who seem to have kind of, I don't know, given up, is that the right word, or kind of dropped their guard. Have a listen to Dr. Walensky, head of the CDC, speaking in Congress this week when she was asked whether the CDC would recommend, in the face of Omicron, better quality masks. Have a listen.
CDC continues to recommend that any mask is better than no mask, and we do encourage all Americans to wear a well-fitting mask to protect themselves and prevent the spread of COVID-19, and that recommendation is not going to change.
Dr. Spencer, that may have been okay guidance in the summer of 2020, but this is now January 2022. We're facing Omicron. Surely they need to come out now and say, no, the cloth masks are a waste of time. The surgical masks don't work as well as the KN95s and the N95s. Why not say that?
To be honest, I'm also flummoxed. I'm not sure. Look, when I go to work, I wear an N95 because that's what keeps me safe. I think that, like Dr. Blackstock has been talking about this whole pandemic, this is an issue of equity, just like testing,
yes.
Right? The people that aren't getting tested are the people that can't wait in line for 4 hours. That means those are people that are not going to be identified for those oral antiviral pills early on. It's an issue of equity when we're talking about N95s, KN95s, masks that can be prohibitively expensive for people. Instead of, at the end of November, implementing a travel ban against Southern African countries, what we should have been doing is mobilizing, getting those N95s out to every single household so that people could have had the same protection regardless of your income, where you live, what your underlying health problems are. The problem is we're discussing this now in the middle of January. This should have been taken care of by the middle of December.
Yeah, it's deeply frustrating, the slowness with which they've come to testing and masking, and it is an equity issue, and I appreciate both of you making that point. Doctors Craig Spencer and Uché Blackstock, thank you so much for your time tonight.